Stem cell therapy is a growing medical treatment that is making a real difference for patients, but there are several types available, and it is important to be informed. That is also why we enjoy our visits with Dr. Lanzasero so much from Total Regenerative Therapy. Good morning, doctor. Good to see you again.
Good morning, Carly. Good morning.
This is so true. Let's start with this on being informed. You say that's actually the best patient that you can actually come into your office.
Right. We enjoy educating the public, especially with this new revolutionary therapy.
It's new, but it's been around for several
Well,
years.
You're
and
right.
A lot of good response from this, but there's still so much I think people have to learn about this.
And it actually isn't new. It's been used for bone marrow transplants since the early 70s, but more recently for chronic degenerative joint conditions, knees, hips, neck, low back, etc.
One of the things that I think people, what I've learned from you specifically too, is the different types of stem cells too that people are using. Why is that important to know and be informed on?
Right. Well, the two main types are autologous. We've talked about this, where they use your own stem cells from your body fat or bone marrow. And then the stem cells we use from a donated tissue from a baby, a healthy born baby, the umbilical cord tissue. So in this case, the autologous, where you're using your own, is really outdated therapy. You want to use the umbilical cord tissue, and specifically something called the Wharton's jelly, named after Dr. Wharton.
Okay.
Right? And the Wharton's jelly is the jelly that's in the placenta that protects the umbilical cord blood vessels as the baby's growing.
Education on this is so key. This is why you travel quite a bit and do seminars across the Bay Area. I know in Orlando. Talk about why it is that you do that and how often you're doing that.
Well, I really like an educated patient coming into the office so that they understand, they have a basic understanding of what we're doing. So it makes my job easier and it puts them more at ease. So we explain to them at different seminars what we do, the history of stem cell therapy and the different types. And some people can't come to a seminar, so now we have our book.
Yes, congratulations on this. This is, you know, my first thought when I saw the book was it's so easy to Google something, right? Look for something online.
Right.
But then the problem is you're getting so much information and it's hard to know what's true, what's factual.
Right.
This, you've put together a very easy to understand and quick read to break it down.
It's a quick read.
Yeah.
It's a good summary of the common types of stem cell therapy, what we do in the office, and how we approach this with our integrated medical staff. So people can get this on Amazon.com.
Okay. You know what's so interesting about stem cell therapy? It's one of those things, I don't know if people are going to the regular, general practitioner or whatever, the doctors that they've seen for quite some time. I just don't know how often stem cell is actually brought up, which that's why it's so important to get the word out about this. Do you hear that a lot, that people go, why did no one say this?
Right. Actually, what I'm starting to hear more of now is their general practitioner, family doctors saying, I think you should have that done.
You are hearing that. Okay, that's good. That's what you want, for people to know their options.
Absolutely. So for people with chronic arthritis in the knees, hips, shoulder, that don't want surgery, they don't want a knee replacement, or if they have chronic neck or back pain, they don't want another surgery, stem cell therapy is being recommended to them.
For those who have educated themselves, know and go, okay, I'm ready for stem cell therapy, what would you have them do? What's the next step?
They need to come into the office for a consultation to make sure they're a good candidate for this therapy. We'll consult with them, take their history, come up with a stem cell therapy plan for them, go over the fees with them, and they'll know everything they need to do once they leave that visit.
Doctor, again, thank you so much for your time. Thank you for educating on this subject. There's lots more to delve into. We look forward to seeing you again soon, but congratulations on the book. Again, available at Amazon. But in the meantime, there is the number to get your questions answered today, or of course, check them out online as well. All right, and real quick, before we let you go, you actually have a launch party that you want to invite people to as well for the book. Right,
in Celebration, Florida on November 28th at the Bohemian Hotel. We'll have a launch party for the book. There's a stem cell therapy seminar that day, and each attendee gets a free copy.
That's awesome. In the meantime, if you can't, though, Amazon.com is also going to help.
Amazon.com.
Thank you, doctor.
You're welcome.